Thank you so much for joining us for the Express News Medicare panel discussion. This panel is intended to help provide helpful information to San Antonians and the surrounding area and their Medicare needs. This discussion is moderated by San Antonio Express News Marketing Director Sarah Bryant. Panelists include Medicare Advantage Plans Director Brandy Gamboa with Community First Health Plans, and Community Healthcare Manager Stephen Vargas with Gonzaba Medical Group. Thank you everyone for joining us. So let's go over what insurance landscapes look like for 2024 in the Bexar County area. I think that it's interesting because Medicare is sort of this complex environment and it seems unapproachable sometimes. And I think that when we break it down to what the county impact is and what the community is facing when they make these decisions, it will be helpful to have this conversation from both of your vantage points. So for starters, it's gonna be a two-part question for you guys. The first is, when is the Medicare enrollment period? And then are there penalties for not enrolling during those dates? And so the first question, I'm gonna hand off to you, Stephen, because I think that that timing is so critical for people to know. And then the second question for you, Brandy, just in terms of those details. So Stephen, please. Thank you.
Yes, of course. So the annual enrollment period, which is AEP, actually begins October 15th, and it goes all the way through December the 7th.
And then if we don't get into this time slot, Brandy, what happens for us?
That's a good question because it can affect many individuals. If you're eligible and you don't take advantage of enrolling during the annual enrollment period, you could face some Part B and some Part D penalties. The Part B penalties are about 10% for each full 12 months that you're not covered. And the Part D penalties are 1% of the nation's base premium for every month that you're not covered. So, and these penalties can be for lifetime. So if you don't have credible coverage, it can impact you, which is why it's so important that you look up Medicare.gov or you go to your community resources to find out how these penalties will affect you and what you need to do to enroll while you are eligible.
So it could be a lifetime. And
Yeah.
so that enrollment period is so critical that Stephen mentioned, but then also on top of that, the penalties that we face could be throughout the entire rest of our lives or for the Medicare period. How does that penalty work?
It can be for your lifetime. There are some exceptions, depending on, your conditions. You do need to look at Medicare.gov on what those exceptions can be because they can change. But what's most important is that if you reach out to your community resources like brokers or agents, they can sit down with you and prevent this from even occurring in the first place. And that's why it's important to meet with them during this annual enrollment period.
Yes, the timing is everything on this.
It is.
So we briefly hinted at it, but how do individuals find out more information on which plans to enroll in? And Brandy, I'll come to you for that because I think that in terms of all of the different plans, it's just critical to know where to go. Where am I going for this information?
Yes, so there are two different types of plans. There is the original, also known as traditional Medicare, and then there are Medicare Advantage plans. So the difference is the original Medicare consists of Part A and Part B, which means that you can go to any doctor or any hospital nationwide within the US that covers Medicare. And in most cases, original Medicare, Part A is free. You just have to pay a Part B premium. However, if you want drug coverage, you're going to have to pay an additional premium on top of Part B premium. So that's something that you have to look at. And original Medicare doesn't consist of additional benefits like Medicare Advantage does. So under the original Medicare plan, You don't really need to get a referral to see a specialist, which is a good thing. But you also have to consider that there's usually no limit on your out of pocket spending. So there's a lot of pros and cons there. Our Medicare Advantage plan, they're run by private insurance companies. And the great thing about Medicare Advantage plans is that they have Part A, Part B, and Part D all rolled up in one. And you will continue to pay your Part B premium, but your Part D is usually included with no cost, no additional cost. And under Medicare Advantage plans, you get a lot of additional benefits that you don't get under original Medicare, as vision, dental, hearing, so that you can get your routine visits done. You can get hearing aids, glasses, and it also has an out of pocket limit. So for those, if you have high medical costs, you won't have to pay anything after you reach that limit. So there's a lot of great things about Medicare Advantage plan, but then original plan also has its benefits. So you have to go to medicare.gov and find out what's best for you. What plan is going to work for you better?
Excellent. I think that if I were choosing today, I would choose Medicare Advantage just because of all the things that I need to cover. But it also makes me think about, and Stephen, I'm going to come to you for this. I already have things set up, right? I already have this whole group of doctors that's helping me with my entire health. So I want to sort of keep that family care, right? I want to keep my records with my doctor. So how does this, when I switch over to, let's say, Advantage or Original, how do I keep my family doctor? And is there a particular plan that I need to stay on to do so?
Yeah, and that's a very good question. And just to touch base on what Brandy was saying, this is why we always at Gonzaba Medical Group, we always recommend to our patients and our non-patients to always sit down with a licensed, experienced agent. So this way, when they're going over the Medicare Advantage plans, either that the patient is on right now or they're going to choose another, they can always research and make sure that the doctor is in network with them. That's very important because I know how we know how important that is to seniors right now, and the main concern is they don't want to lose their current PCP. So that's why we always encourage, let's get you with a licensed, experienced agent so they can sit down with you. First of all, go over the benefits and the advantage plans, and to make sure that your primary care physician is accepting one of those plans.
Yeah. I mean, I can only imagine, having to repeat my information again to an entire new group of doctors after I've been with them for so long. So I know that it's important to keep that family doctor. So what differentiates Gonzaba in terms of that, in terms of geriatric and elder care? How is it different from other medical groups, and what could I expect from that Gonzaba difference?
Yeah, it is a Gandaba difference, and it's like the slogan says, "Como familia," and it's the total approach to everything that we do. And what that is like if we do have a patient that is on a Medicare Advantage plan that we accept, and they want to switch to Gonzaba Medical Group, we will handle everything for them when they come into our PCP. So not only will the PCP have our patient, do their labs and X-rays and everything that we have to take care of for their first initial visit, but we'll also reach out to their existing PCP to get all the records transferred over to us. What differentiates us from everyone else is not only does the patient have the Gonzaba PCP with them, but they also have over 700 employees that are backing that patient up as well, from our patient advocate to our contact center to our referral department to our verification department. So we basically take care of everything for them. So that's less worry that they have to do. And all they have to do is come in and see our doctor to get going with us.
I love that. That is exactly, I mean, I'm thinking about my mom in terms of being a Medicare patient and just all of the doctors, and she's always having to deal with, well, I just spoke about that, and so having sort of that advocate, that connected advocate throughout the entire experience, that sounds like a huge differentiator, and I think that it is a model in which. Um, other medical groups do not have. So I want to come back to you, Brandy, because the Center for Medicare and Medicaid Services announced changes, and so we just talked about how nice it is to have the consistency and how nice it is to have one coordinated care plan. Um, but of course, as anything, there are changes that happen year over year. And so, what are the key updates that we need to know about this year and this upcoming plan in order to stay at a base level of our understanding?
There's actually some big changes coming up. The Inflation Reduction Act, the IRA, has eliminated the 5% coinsurance in the Medicare Part D catastrophic stage, which is this phase is known for high out of pocket expenses for beneficiaries with significant drug costs. So in 2024, they set the threshold at 8,000. What that means is once a beneficiary reaches that threshold, they'll no longer have any out of pocket costs. They don't have to pay that 5% anymore, which is a huge saving for them, especially for the ones who have so many medical costs with drugs related. The IRA will also expand the eligibility for the Medicare Part D low income subsidies, such as extra help. So the extra help program allows low income individuals to either have a zero premium for Medicare Part D and then set co-payments for prescription drugs. And now to be eligible, you have to fall between the 135% and 150% of the federal poverty line and then meet certain other requirements. So a lot more individuals will be eligible for this program and get more help. CMS
That's
is
awesome.
also predicting a 2% decrease in Part D premiums for those enrolled in original Medicare. So there's a lot of savings coming up for the Part D side.
That's awesome. So, in terms of feeling like this is unapproachable for me to get certain plans, there may be new criteria that allow me into the doors that I wasn't going to be allowed in last year.
That's correct. Yes.
Okay, and then Stephen, I'm going to come to you with a question. Um, I understand that when I turn 65 or before, if I'm eligible, that I can come to Gonzaba and get this sort of treatment where I'm insulated with Gonzaba and they know everything about my entire whole health plan. So can you talk a little bit about that experience with Gonzaba?
Yes, of course. So when someone is getting ready to turn 65, there's a lot of confusion. We want them to understand that you have time to enroll into Medicare. You can do it 3 months before your birthday, the month of your birthday, or 3 months after. So this way you have plenty of time to think about it and ask questions. And they can always call us here at Gonzaba Medical Group so we can help them with that. And again, we can always contact them with a licensed agent so they can guide them through the process. Also, too, you don't always have to be 65 to join Gonzaba Medical Group to be a patient, because we have a lot of patients in our group that are in their 50s, but they're on Medicare. But see, they don't. What happens is they don't understand when they're on Medicare about the Medicare Advantage plans that they can get into, and that's where we come in to help them and guide them through the whole process. So, always give us a call at Gonzaba if you have any questions, to be part of the total approach. And when we say the total approach, it is the total approach to senior healthcare. What I like to do is give you a little example of what we go by when we have the total approach with the entire experience that we have at Gonzaba Medical Group, from everything that we have in-house to our specialty center, to our physical therapy, to urgent care, and then of course your primary care physician. And what I like to do is, for a little example of what we do and how we do the coordinated care model, is let's just say, for example, we have a patient that comes in to see their PCP and their symptoms are, they're out of breath. They don't know what to do. They're thinking all kinds of thoughts that they might be having a stroke or a heart attack. So what we do first is we coordinate with the PCP. Then the PCP will coordinate with the Gonzaba in-house nursing services. We'll send the patient to get an EKG. Okay, so we can check and see. We'll do a pulmonary function test. And then what we're going to do is we're going to send them to our advanced imaging department. That's all in-house. So we'll take some
Wow.
x-rays of the patient to make sure that everything is okay, just to give them some more peace of mind for them. After we take the x-rays of their heart and of their lungs, everything looks normal. We're then going to send them to our labs to do some blood drawn. Now, after we send them to our labs to do blood drawn, we end up finding out that the shortness of breath was all caused because the patient was anemic, low iron. And that's how we take care of them, because then the PCP now went to explain to the patient what was going on. So we lowered them down, their anxiety went away. And all we found out at the end of the day that it was just low iron that you had, and we just needed to take care of that. And everything is done. And that is the coordinated care that everything is done with, because all those things that we do, the process, it is all done in-house. One of the problems that we know that seniors have is getting around in transportation, and a lot of them sometimes have to go here and go there across San Antonio. But with Gonzalo Medical Group and all services under one roof, this entire process that I explained is all done in-house for them, where it's convenient. We have our own urgent care that communicates with their primary care physician, and everything is done right there for them before they leave at the end of the day. That is the total approach to Gonzalo Medical Group. That is what makes us so unique. And that is why we are here to help them, because of everything that we can offer.
That is awesome. I love that whole connected health plan. It's fantastic that you have that coordinated care model. I so wish that I would have known about that a little bit ago because of my mom and having some physical ailments, and I'm at work. I can't coordinate her to get to a doctor, and she's having to wait and look at my schedule and figure out when I can get her up to the doctor. And I feel like that you're willing to pick up the patient and then bring them into the fold with that coordinated care. It's amazing.
Yes,
Um,
Brent, and it's funny that you say that, because we have that experience all the time here at Gonzaba. We
mhm,
find patients that rely on their children to take them to the doctor, and seniors don't like to miss their appointments.
no.
And we have seniors that give us a call and they tell us, my son had to go into work at the last minute. What do I do? I don't know what to do. I've already used up all my transportation on my health plan, but I need to see my doctor. How can I get there? Our patient advocates will come and play. We'll get a taxi, or we go through another service that we send someone out to go pick up the patient, bring them to their primary care to see their doctor, and then we have them take them home as well, and we cover the cost for that. Our main concern is that they come in to continue to see their doctor to make sure that they're well taken care of. Those are the unique steps that we do at Gonzalo Medical Group that makes us different from all others.
Yeah. I love that. I am absolutely a huge fan of that process as a sandwich generation, as we call ourselves, taking care of a child and a parent. So it's a huge benefit for people like me as well. Um, and then, Brandy, did you feel like you needed to add upon that question, or do you have other questions that you need to fulfill as a part of what you want to get across?
The good thing about one thing that you mentioned is fraud. One thing that members can do is that they can go to the specific websites of organizations they trust, like Community First Health Plans and Gonzaba. And most of the time on our websites, not only are we going to have information about our particular plans that we offer, but it's going to have phone numbers to directly to our agents and brokers that you feel comfortable knowing I'm going to call them. They're not going to call me because they need permission. They can't just cold call. They're not able to do that. They need permission to say, hey, you want help? I'm going to be there and I'm going to help you. I'm going to make sure that you get into the right plan, the plan that's going to give you care coordination, the plan that's going to give you the prescriptions that you need, and the plan that's going to have the provider you want to see in your network. So most of these websites will have the direct line to contact that broker who will go to your house and meet with you one-on-one to make sure that they enroll you in the right plan.
Yeah, I think one thing that you said is so important, especially with fraud, is that you can contact them. They won't contact you, because I think that that's part of the entry of the fraudster, is that they contact the senior and gain information from the senior that shouldn't be how the senior is interacting with the brand, just for safety, for their information and for their health.
Yeah, it's definitely a red flag if somebody calls you and asks you about your insurance and asks you for your personal information. CMS says that's a red flag. Don't provide them with any of that information. If you have to, hang up and call that company back.
Yeah, yeah, absolutely. It's interesting because I also have had, an experience with my dad where he was in the hospital and his phone was continually ringing, constantly, and he was on so much medication. I would come into his room and he would be on the phone telling people about his information, and I would hang up and I'd be like, Dad, you can't talk to them about your information. You're in the hospital, you're not feeling well, you're on medication, and they were trying to get information. So it is important to know that the scam can come through them contacting you on the telephone. Yeah. So the new, opening the door to the new, because with change, there's also new benefits. Are there anything are there anything that the audience should know in terms of those shiny new objects, those things that they shouldn't miss, in terms of signing up for their plan, that we need to highlight here?
So not specifically new to Medicare Advantage, but it's new to anybody who's enrolling in Medicare Advantage for the first time. Some shiny benefits that they're going to get that they don't get with the original Medicare is mentioned earlier: vision, hearing, dental, but they can also get an over-the-counter card. And what that is it's kind of like a little debit card that they utilize for Tylenol, allergy medications, dental medication, and much more. They can also get emergency response system benefits, where they have a personal medical alert system so that they feel confident living on their own in case they were to have a fall or an injury or just a medical emergency. There's 24-hour nurse advice lines under the Medicare Advantage plan, and home delivered meals, health and wellness programs. We even have fitness benefits such as membership with YMCA or silver sneakers. Of course, every Medicare Advantage plan offers different kind of benefits, shiny benefits. So that's why it's important for the beneficiaries and the community to review all these plan options and see, well, this Medicare Advantage plan is offering this, but this one's offering this. Which one's better for me? What is more important to me?
Yeah. Well, right now, with the allergies like they are, that allergy part is real important to me.
Oh, me too.
San
Absolutely.
Antonio. Oh my goodness. Oh, they are something else. They're a unique breed of allergens. Um,
Especially rain.
yeah, so I think that is important. I mean, we're talking about the fabric of San Antonio and a generation that has impacted the community, and taking care of them and making sure that their health is recognized, and not neglected. So, in terms of giving back to the community, and Stephen, I'm going to start with you, with Gonzaba. I know there are things that the brand does to impact the care of seniors, but also just the greater impact of San Antonio itself. If you could explain a little bit about what Gonzaba is doing for the San Antonio community and how they are positively impacting.
Absolutely. So there are so many things that we're doing here at Gonzaba for the community of San Antonio, for our seniors. As you know, during the summer times, it gets very, very hot and humid in San Antonio. We kind of find that there's a lot of seniors out there that don't have, the luxury of having an air conditioner or a central unit. And all they go by is just opening up their windows to get some fresh air. So we have events like we give away fans to the community so they can come and get a free fan from us. We also help our seniors right now with all the inflation of cost that's going around, especially for food. We do food drives such as produce giveaways with vegetables or fruit, things like that, so we can help them out a little bit. Also, too, we do other things that we want to keep them going, and exercising is very important for seniors, and that's one thing that we emphasize, that all of our doctors at Gonzaba Medical Group emphasize and recommend, is for them to stay active. And by helping them, we create these dances and events that they can go to. We do 4 huge dances a year at the Freeman Expo Hall. That we get over 2,000 plus seniors that they can just come on out. They get a free lunch. They have a good old time. They get to dance and exercise, walk around. We also encourage for them to walk around at home or do some Zumba classes that we offer here at our event centers. We do so much so that way we can keep them active and keep them going. Also too, in the community, another big thing that we do is we like to team up with the Meals on Wheels as well, where we can help distribute food to the seniors that are in need. We do so much; it's just unbelievable, and we get credited. We get thanks all the time from our seniors, and it's a special moment for us. It's a special moment for us because what we do for them, it's a passion that we have, because we all have parents, and we all know that they need someone to help them and guide them and hold their hands, and that's why we do what we do, because we just love interacting with them and giving back, because nothing feels better than when they walk away with a smile because of something they received at no cost from Gonzalo Medical Group.
That's awesome. So I love to dance. I would love to volunteer at one of the dances. It would be such a fun hoot to just get involved there. I think that's so cool. And the health impact that you guys are creating is tremendous. So thank you for the work, and for Gonzaba's work
Absolutely.
with that population. Brittany, I'm going to ask you the same, because I know that community first health plans also is just a huge contributor to the San Antonio community. So if you could also share with us a little bit about what they're doing for the senior population.
Of course. Well, one of the things that we do is, as the only local nonprofit insurance provider here in San Antonio, we know that we have to do more than just health coverage. So we also provide things like food pantry initiatives. And we collaborate with many local schools, and we have kind of like a store where people can go in the community who need canned food and hygiene products, and at no cost, even pet food. And we even have the community involved now, where they even go and drop off, donations. So it's something that has, come to a lighting where a lot of people needed it. And we now have 49 locations, and you can find that at communityfirsthealthplans.com. You can see all the different locations. That way you can visit those stations and donate if you're able to. Other examples of our community partnerships are with YMCA. We sponsor over 50 youth sports teams and provide free membership to our Medicare seniors. We have a partnership with Ride Connect, where we sponsor year-long fuel so that people can get to places with low-cost transportation to seniors. We have the Any Baby Can, where we partner in providing case management, Christmas toy drives, and support services. Our mission here is not only to just improve the health outcomes of our members, but also to improve the overall health of our community.
Yeah, absolutely. I mean, with food costs rising so much, I know that so many people are in need of food, and that continues to just be an issue that we face in San Antonio. So it's amazing that both Gonzaba and Community First Health Plans are helping out in that effort. Um, so I think that what I'd love to do is I'd love to open up the floor if there's any additional thoughts that you have, and that you want to express in terms of Medicare and the experience that the senior population within San Antonio will experience this year. Um, Please, an open forum for you.
Great. So, honestly, right now, my most important thing to share with the community and our seniors is, keep a lookout for important dates like the annual enrollment period that starts October 15th. We have a Medicare online enrollment center through medicare.gov that you can go through and compare so many different plans and see which one is best for you. Keep a lookout you can also look at our website, Community First, for community outreach programs that we're involved in. We would love for the community to join us. So there's a lot of different options. And that would be my most important advice, is just to make sure that you keep a lookout for all the important dates coming up.
Yeah, that's great advice. The date is so crucial. Stephen, did you have anything that you wanted to add?
Of course, and Brandy touched on a lot of things, which is very important. We just always emphasize to our patients and to the senior population during the annual enrollment period. We encourage them to make sure that they sit down with a licensed agent so they can go over their benefits and their health plan to see if they have the proper coverage that they need. And that's one of the things that our senior population, that our patients love, is that we're available for them here, where they can give us a call at our contact center, and we can help answer their questions and even get them in contact with a licensed agent, so that way they can help them and sit them down and go over their health plan. There's so many things going on around this time, where, the seniors, there's a lot of scams out there. We want to educate them and help them, and let them know, hey, if you have any doubts, any questions, please give us a call here at Gonzaba, and we're more than welcome to help you and guide you. The most important thing that I've learned working here at Gonzaba Medical Group and working with seniors for over 9 years is that a lot of them don't understand what they're getting into. They just say yes to a plan because they were told by their family members or a friend, or they saw a famous movie actor on the commercial saying, get this and everything. And they just get enrolled. And then later they come to find out, first, their PCP is not accepting the plan. They don't have the proper coverage that they should have because, there's different qualifications, and they're lost, and they feel alone. And that's where we come in. We want to make sure that and let them know that during this time, they are not alone. We're here to help them in every way possible. We're more than welcome to sit down with them and get a licensed agent to sit down with them, go over their plans and details, and guide them from there and help pick the best plan and solution that's for them. That's so important.
Yeah, it is so important. And there are so many scams, and there are so many brands that are not credible, that come in and try to take advantage of the senior population. So I think that the trust and the credibility that both of your brands have is crucial for seniors to know that they can reach out and that they can get the help that is respectful of their needs and will not lead them into astray in terms of the Medicare process. Well, thank you so much, both of you, Stephen and Brandy, for the dialogue. I think that just based on this information, I feel like a senior would have a place to go, a safe place to go, information that gets them to the right questions that they need to ask, and that they know that the brands of Gonzaba and the brand of Community First Health Plans are there for them and will be a partner in their next portion of life, which is the Medicare portion. Thank you both so much for being here and for providing this wealth of information to the community of San Antonio. We really appreciate your time. Appreciate you opening up the brand experience to our readers and to enlighten us about the Medicare process. If you would like more information about Medicare and you're coming in through the Express News channels, if you can go to mysa.com/Medicare, all of the information from Gonzaba and Community First Health Plans will be there, as well as this panel, so that you can invest more time in learning about Medicare experience and how to effectively use it in the next coming year. Thank you so much.